Hey everybody, Dr. Jared Skowron from Spectrum Awakening. What we're going to talk about today is helping control autism behaviors. So when I talk to patients in my practice, patients in my office, and families, whether it's on Zoom or wherever it may be, a lot of people talk about, I need language and I've got behavior problems. Those seem to be the two bigger things that affect your quality of life. So we're going to talk about today is different behaviors that some kids have, different extremes of some behaviors, what those might mean, and how we can kind of figure it out. Because there are so many things that can cause behaviors in our kids. And when I say behaviors, I mean behaviors that we don't want, all right? This is massive hyperactivity, this is self-harming, this is harming others, this is not sleeping. So a lot of different behaviors, and if it's not a behavior that seems to fit a good quality of life, that's what we want to help support. All right, before we get into it, I've got a, I got a request. Next week, I'm going down to visit my producer, the team that makes all my supplements, that ships all the supplements to you guys. I'm going to see them, and we're going to be talking about new products and what we're going to make for 2022. What I would love to do is to show them some of our awesome stories. And this is where I need you. If you would like to share any awesome story with all the team that makes our vitamins, so you can tell them, hey, thank you for producing this. This is the stuff that's helped my child. We would love to see like a little, just 10 seconds or 20 seconds, like a before and after video of your child. This is them before the supplements. This is them after the supplements. This is kind of how I saw my child improve. I think, a group like that is so disconnected from what they do helps people. Okay, they do it and they make the stuff and they send it out, but they never get to see the results. So if anybody would like to privately send us a little before and after video of their child, we would love to share those kind of stories of hope. This is not for anywhere else. This is not for social media or advertising or anything. This is just to show our team how awesome they are. So if you would like to do that, we would love your help. What we are going to do, I think we're going to pick the best 10 or something, and in exchange for you, sharing your story, we're going to send you a free supplement of your choice. Okay, so if you could submit that to our social media privately, this is, and it can be anonymous. We're not going to share any names. We just want to share stories of hope and show what this stuff does. So that's all up for you guys. So I appreciate your help if you would like to take part of that, but obviously not necessary. All right, let's get into behaviors. So I was actually recording a summit for Autism Parenting Magazine. They're coming out with a summit in April, and I did a whole recording of a summit for them yesterday about behaviors. And I thought, wow, this would be a great thing for us to talk about on Facebook Live. So I've already kind of gone through all the different stuff and want to show it with you. So the first thing I want you to think about with behaviors is, what are the troublesome behaviors my child has? Okay. And then understand there are so many factors that can create that behavior. And so when we want to intervene and help with a behavior, it is definitely not one size fits all. And so we've got to figure that out. So I typed this up this morning and kind of grouping behaviors in two. Are your kids angry? Are they violent? Are they harming themselves, or are they harming others? Okay. I want to answer a quick question very quickly. Tanya asked, would you explain how leucovorin and your superfolinic acid is different? I'd love to do that. The short answer is leucovorin is folinic acid, period. Okay. Leucovorin has a lot of other ingredients that you may not want, including gluten. Gluten is present in many, not all, many forms of leucovorin. Our folinic acid has cofactors that help it absorb across the blood-brain barrier for what I think is better effect. What I tell most of my patients is, try leucovorin, try our folinic acid, and see which one works better. Honestly, that's what you want, is what works for your kid. So try everything. We also have a free course on our website that describes our folinic acid supplement in detail about why it works better, or why I think it works better. So you can go to our website, spectrumawakening.com, click education. You'll go to our education page, and there's a course on folate and MTHFR. It's a free course. Some of our courses have a fee, some are free. That one's free. Watch it, it'll give you all the different forms. All right, let's go back to our topic. Is your child angry? Are they violent? Are they harming themselves? Are they harming others? Okay. compared to kids who are hyper and reactive but not purposely violent. So a lot of kids, if they're doing their own thing and you leave them alone, they're okay. Hey, I'm on my tablet, I'm doing whatever, I'm fine. But when you transition or you move to a non-preferred activity, okay? Like, hey, I'm watching the Super Bowl and you want me to clean the toilet, that's a non-preferred activity, I'm gonna be upset, all right? So am I defensive in nature? Am I reacting, or am I purposefully angry and violent all the time? That's how I'm kind of categorizing these two areas, just to kind of get your brain thinking about, hey, what is my child doing, all right? For those who are angry, violent, self-harming, or harming, you've gotta think about pain, okay? Most of our kids who can't talk can't express pain, all right? What if they have pain? And what kind of pain is common with our kids, all right? First off, is it some kind of stomach pain? Because a stomach pain could be an intestinal infection. It could be poor digestion. It could be a food reaction, okay? Any of those different things. And how do you know that there's pain in the stomach? Usually they're gonna be pushing on it, okay? Usually they'll push on their stomach to see if it feels better. Sometimes they'll arch their back to see if it helps their stomach feel better. They may have changes in bowels. They may have a lot of farting. They may have really smelly gas. There may be a lot of nausea or acid reflux. Some kids will hit their chest because they have acid reflux. Yeah, it burns. It burns because it's stomach acid, okay? So you think about that first, all right? And then if you do have pain in the stomach or abdominal pain, you've got to go figure that out. You know, is it a food reaction? Should you do a food allergy test, food sensitivity test? Is it a digestive problem? Should you try a digestive enzyme? Is it an intestinal infection? Should you do a stool test or an oat test to figure that out? All right. Those are the kind of things that you'll want to do to figure out, is it a stomach issue? All right. Next, headache. All right. Headaches are very common in our kids. Whether that headache is a reaction from a food, which is very common, especially reactions to artificial food dyes can cause those. Is it just general inflammation? Is it inflammation from an autoimmune condition like pandas or PANS? Is it inflammation from a viral infection? Is it inflammation from teething? I see people forget about this so often just because their child doesn't say it. The child doesn't say, geez, my tooth hurts. They are just banging their head and their face to try to get the pain away, all right? So if it's a typical teething time, whether it's young kids or your 6-year-old molars, is my child teething, and is that causing the pain, and is that causing behavior problems, all right? So, you know, kids with headaches might push on their head, they might bang their head, might rub their head, they might get you to rub their head. You know, again, think about how you react when you're in pain. And is your child having the same behaviors? Okay? Sounds simple, but it's very kind of straightforward and thinking things through. All right. So those are things you'll want to look for. Really no testing for the whole headache and inflammation thing. Yes, we have testing for pandas and PANS. No testing for teething, but you know, think about the pain of the head versus the pain of the stomach. And those are the typical places our kids will have pain that they can't describe or that we cannot see. All right. Next, what about the kids who are hyper? All right, they're reactive, they're not purposely violent, but boy, they're hyper. Your house is a jungle gym. They may not sleep. They may get angry and agitated, but again, it's not to a huge kind of place. If you're easily frustrated, so if you're a family where everybody's walking on eggshells, you know, transitional anxiety is super hard, you've got to consider cortisol. Cortisol is our stress hormone. I talk about this all the time because I see it all the time, all right? Do you have cortisol problems? Because cortisol as our stress hormone will help us handle stress. What stresses out a kid? Transitions, taking them away from things they like. I got my iPad, all right? I'm watching football, whatever I'm watching, and you take that away. Okay, I'm stressed now because I don't know what you're gonna make me do. It might be something I don't like. I'm not sure. Maybe you didn't tell me. Maybe I didn't understand what you told me, but I still am fearful of what's coming up because I'm outside of my happy place. That is definitely cortisol. So you'll want to treat cortisol, test cortisol if necessary. Also, too much adrenaline, all right? Adrenaline, that's your fight or flight hormone, especially if you have B vitamin sensitivity. I would say half our kids have B vitamin sensitivity. They can't handle the B vitamins. They go hyper, all right? That's because too much B vitamins makes too much adrenaline, your fight or flight reaction. Also, what about histamine, okay? Histamine, this is the chemical for your allergies, but histamine also stimulates the brain, causes hyperactivity, all right? You could have a histamine intolerance, just like a lactose intolerance, all right? Too much glutamate, all right? That's another one. Glutamate is another brain chemical that is, creates super fast brain thoughts and a lot of hyperactivity. So a lot of different chemical causes for hyperactivity that you might be hyperactive all the time. You might be not sleeping because you're just go all the time, all right? I just talked to a family here in my office. They said, yeah, our daughter goes to sleep at 8, but wakes up at 2 and doesn't go to bed again until 6. Holy cow, 6, and then you got to wake her up for school. So, somebody who is just nonstop. Look at adrenaline, look at histamine, look at glutamate, okay? So, again, trying to categorize all these different things that could be causing your child to feel uncomfortable. And when they feel uncomfortable, they've got to deal with it somehow, some way, and that is usually with reacting, okay? That kind of reaction takes away from what they're feeling, whether it be the hyperactivity of the adrenaline or the glutamate or the histamine, whether it be the easy frustration of the cortisol, or whether it be if I am hyperactive and biting myself, especially the ones who harm themselves, they're trying to block pain. Okay? When I have a bad migraine, what am I going to do? I'm going to push and shove my head. I might even take something, pointy like a pen and dig into my head because that pain is better than the other pain. This pain I can control, that pain I cannot. Okay? So self-harming, I find, is often pain, self-soothing of pain. So what do we do? And let's get into some research studies about it. All right? First thing, if you think they have a headache, think that, they're banging their head, they're pushing on their head, they want you to rub their head, they probably have a headache or a migraine. And most migraines in kids with autism have to do with the mitochondria, okay? Leslie just said, for no reason, hits and yelling all the time, all right? Sounds like a pain kid. So here's a research study talking about seizures, migraine, and autism, and how this is all related to regulatory pathways in the mitochondria, all right? And people who have migraines, sometimes seizures, you don't have to have seizures, migraines and autism will often have genetic abnormalities in genes called CACNA1A, that's a calcium gene. Let me skip to this one, SCN1A, which is a sodium gene, and that's kind of how the neurons run. They run on electrolytes like calcium and potassium and sodium, etc. And this other gene here called ATP1A2. Now, ATP is the form of molecular energy that mitochondria produce. So treating mitochondria is going to help with a lot of the headaches and migraines and that kind of pain, all right? Now, we can also use anti-inflammatories. I hate Tylenol, acetaminophen, paracetamol, Calpol. Please don't use it. Some research studies say up to 40% of kids with autism are caused by acetaminophen, Tylenol, paracetamol, Calpol. All right? So don't use that, but you can use ibuprofen, but you can't use that long term because you're going to get an ulcer. So what can I use as an anti-inflammatory? All right? You can use something called palmital ethanolamide. Sure is a mouthful, huh? Well, here's a recent study from April of last year about this natural supplement, palmital ethanolamide, in autism, and how research suggests that this PEA, the palmital ethanolamide, that's its acronym, reduces overall autism severity by improving language, social and non-social behaviors, by modulating the immune response, neuroinflammation, neuroplasticity, and mitochondrial function, all right? So we want to treat the mitochondria, which produce ATP, so we're going to give ATP. If your mitochondria aren't making enough energy in the form of ATP, you can take it, all right? So this is our supplement, mitochondria ATP, tablets of ATP, molecular energy from the mitochondria. PEA, we have formulated into a tasteless powder, which we have here, something called Panda Bear. Panda Bear is, the active ingredient is this palmital ethanolamide, wonderful anti-inflammatory for the brain. So if you think you've got outbursts from head pain, and sorry about that. Let me go smack my phone. A little tour of my messy office right there, huh? Better than that time it fell on the ground. I don't know if you were there for that. It was a couple years ago. Phone fell right on the ground. Anyway, if you think you got the migraines, you think you're head banging, try the ATP in the Panda Bear. See if it helps reduce the pain, therefore reducing the behaviors. Okay, let's move on. Next, more inflammation in the brain, either probably caused by a virus, okay? This is a research study, autism spectrum disorder secondary to a viral encephalitis. Encephalitis, just brain inflammation, okay? This is a case study of a 2.5-year-old with viral encephalitis that turned into a clinical course of developmental regression, autistic features, stereotypies, and aphasia. So you're telling me, based on that research study, a viral infection in the brain could cause autism or autism symptoms that get diagnosed as autism, all right? If you've got one of these kids with a lot of head pain, might be a viral infection or an autoimmune pandas pans type of infection. Would highly recommend using antivirals, okay? We've got an antiviral. I don't have any on my desk because we just sold through it. It's called Viragon, all right? It's an antiviral. The main ingredient in there is something called monolaurin. Monolaurin is a wonderful antiviral. In fact, here's a research study from March of 1982, all right? I hate when I hear physicians say there's no research on this stuff. This thing's 40 years old, people. 40 years old. Talks about how monolaurin works for RNA and DNA viruses. And in this research study, all viruses that they tested with monolaurin were reduced in infectivity by 99.9%. Pretty hard to get 99.9%, all right? So monolaurin's great. That's one of the ingredients in our Viragon. I used that when I had COVID. I burned through that in 12 hours. It was great. So again, if you've got one of these head things, you might want to add on this antiviral. All right, moving on. What was the next part? The next part was moving on to those kids who are hyper and reactive but not violent. So let's start with the cortisol. Again, cortisol is the stress hormone that affects easeability of frustration. So if you're walking on eggshells, transitional anxiety, you got to think cortisol. If they're easily upset, this is a web research study just last March 2021 on cortisol and self-injurious behavior among kids with autism. We see it a lot. We do test cortisol in most of our kids, and we see abnormal levels in a majority of them, and we can easily treat it, okay? My favorite way to treat it is with herbs. This is our supplement Temper Tamer. Different herbs in here that will help balance your cortisol levels. We also have something called pregnenolone, which will help balance cortisol levels, and something called Sanity Saver, which helps. I think the Temper Tamer is the more effective one, but still, any of this stuff can work. All right, next, I just saw a question about somebody who had encephalitis. Oh, we got to treat, I would treat that. Boy, I would treat that viral. Try the Viragon. Try the Viragon. Yeah, see how that works. And the Panda Bear. All right, next, we talked about histamine, adrenaline, and glutamate. A couple more research studies, and I'll get to your live questions. Here we have histamine antagonists ameliorate autism-like behaviors in mice. So let me explain that. This is an animal study on autism, and they gave a drug that blocks the effect of histamine on the brain. Now remember, histamine is that chemical that causes allergic symptoms. We know that, all right? But what most people don't know is that histamine also affects the brain, all right? Oh, Daniela just said, used Viragon last week for COVID and all symptoms were gone in a day. Thank you. Good for you, Daniela. I know Omicron's much more mild than other variants, but boy, we gotta treat this stuff as well as we can if we get it. So, gave that to my daughter too. And she, one day, slept it off. She was fine. So, histamine hits the brain and causes hyperactivity. That's what you need to know. If you give drugs, based on that research study, that block the effect of histamine hitting the brain, you improve autism-like symptoms in that animal study, all right? So what we want to do is decrease histamine. There are histamine digestive enzymes out there, so you can use those. Those are expensive. We also have supplements that will help metabolize histamine. We have something called histamine C, which is vitamin C and a bunch of other bioflavonoids that help metabolize and remove histamine, okay? There's also certain foods with histamine. You may want to reduce those. A lot of cold cuts, hot dogs, processed meats, things with vinegar, olives, pickles, ketchup, that kind of stuff has a lot of histamine, okay? Last but not least, we talked about glutamate. Now, glutamate, like monosodium glutamate, is a brain stimulant that can cause a lot of hyperactivity in our kids. This is a research study about glutamate and autism and glutamate receptor antagonists. And again, just like histamine, there are these drugs that will block the effect of glutamate in the brain. All right, it's like a bouncer at a club. All right, so we want to get rid of that glutamate. Now, glutamate can be converted into glutathione. I saw a question on glutathione go through. Glutathione is the major antioxidant and repair chemical of the body. So we've created a supplement which is called anger management, appropriately, and that takes glutamate and turns it into glutathione. So not only do you reduce hyperactivity, but you produce a healing chemical, which I think is just a win-win across the board. So definitely things you can do. One other thing I'd like to mention, one of our most, everybody's talking about Viragon on the comments, I love it. One of our most popular supplements, I think this is our number 2 most popular supplement, is Common Cool. Common Cool is another great supplement that can help reduce hyperactivity. It's not for the pain, it's not for the anger, but it is for hyperactivity. The main ingredient is inositol. And inositol is a great neurorelaxant. It also has taurine and GABA and theanine, so it's very calming as well, and it's a nice sweet tasting powder, so you can try Common Cool. All right, let me do a little review, and then we will get to the live questions. Behaviors, okay? Sometimes our kids have behaviors we don't like, especially if they're hurting themselves or hurting others. Please think about pain in the stomach, digestion, food reactions, infections. Get a stool test if you need one. Get a food allergy test if you need one. Headaches, okay? Do they have mitochondrial problems? Do they have inflammation? Are they just teething, okay? And this is gonna pass, all right? Or is there some kind of pandas autoimmune when their behavior gets much worse after a cold? I've seen a lot of COVID PANS reactions lately, okay? You gotta be careful. Or is it just hyperactivity? Are they easily frustrated? Check that cortisol. Treat it with a temper tamer. Are they hyper because too much adrenaline, which goes along with the B vitamin sensitivity, histamine, and glutamate? So I know this is not an easy one-to-one correlation, all right? Behaviors are not. Same thing with fatigue. People tell me, I'm tired. I'm like, holy cow, there's a million reasons you could be tired. Behaviors are not cut and dry. Okay, I don't want to just zombie somebody out with risperidone because I don't like their behaviors, all right? You want to put on some weight, try some risperidone. But we can get down to the medical cause of it. Is it pain? Pain in the stomach? Is it a migraine and a headache from a mitochondrial issue? Do you have a candida infection? Is there too much adrenaline? Is there too much histamine? Is there too much glutamate? Is there an imbalance of cortisol? A lot of moving parts here. Hopefully this helped explain the different presentations of them and different things you can try. Quick note on our supplements, if you want to try any of them, we've got a 30-day return policy, okay? I know the stuff that I've created works. I want you to try it. I want you to help your kids, but I know nothing works with everybody. So 30 days, try it. If they don't like the taste, if it doesn't work, whatever, send it back for a refund, okay? Also, for any internationals, we are creating distributorships with Mandy Mart in the UK and the EU, with Super Supplements in India. We're working on other distributors in other countries so we can get this stuff to you affordably. We do ship international, but you have to pay shipping fees, you have to pay customs fees. You know, it's problematic. We're trying to fix that.